convene the leaders of those two systems in order to try to drive us towards an integrated academic medical center. Unfortunately, that didn't work out at the time. This effort is being led by them. So the hospital administrators called me a couple of days ago to advise me that they were doing this, but I have to give them a lot of credit. This is being driven by them, they're working together, and I have said to them, let me know how I can support the effort, but it's really being driven by the leaders. Look, there's a lot of unknowns, so we have to figure out how will it be done, etc. But the concept is very consistent with what I'm laying out here. Better integration, better communication, less fragmentation, investments in community care, and I will add a commitment to the workforce. I think that's very important.
How do you envision all of that coming together?
I'm sorry?
How do you envision all of that coming together, all of that?
I think there are different ways that, they've just started. They're giving themselves, I think, 90 days to figure out the details.
Reworking the healthcare system in the state.
I'm sorry. Okay. Yeah.
What is it you're looking for? What's the aim here?
Yeah. So some of it's what I announced today. Investments in primary care, investments in health equity zones, investments in pediatricians, investments in frontline employees. The vision that I have that we need to move towards is tilting the system away from the most expensive institutional settings towards, home care and primary care, towards preventative efforts, and really towards health, a focus on health and equity, which means a lot of this has to happen in a community. So what we've seen is we've learned a lot in this crisis. We've learned that there are inherent struggles with infection control in nursing homes. We've learned that we need to do more to shore up our home health care system. We've learned that hospitals are fragile. Our hospital systems are fragile, and we're going to be there for them, and thank God we got the money from Congress to, as I said, this $150 million. But if they come together and have an integrated system, they'll be stronger, both financially and also in delivering care.
The salary boost you talked about for hospital or healthcare workers who are paid under $20, how much does that cost to date? How much do you anticipate it's going to cost in the future?
Can you help me?
We've spent, for the first month, we spent $8.7 million, and then we're budgeting up to $5 million for the final 2 weeks. But we won't, it's an application process, so that's an estimate based upon usage.
Governor, you mentioned you've learned a lot about, especially infection control in nursing homes, and I think it was yesterday or the day before when you talked about nursing homes and letting patients leave the hospital with COVID to go to nursing homes, and maybe that wasn't the best idea, but at the same time you cut off visitation. So how do those two things kind of square with each other? If you knew it was a problem to let people into nursing homes, but also let people in from the hospitals, and what was the thinking?
Well, now we've stopped both. So what I said was that in the very early days, we did, folks were released who were COVID positive to various nursing homes, and now we're not doing that. Now we're putting people together. We have these COVID positive homes.
I guess what I'm getting at is, was that still after the visitation was stopped? Were people being allowed to leave hospitals while they were COVID positive after visitation was stopped?
Not.
Okay.
No, I think not. Now you're like testing my memory, but these releases were like in the first few days or week that we were getting ourselves organized, and then very quickly we shut down that practice and shut down visitation. And still, as you know, shutting down visitation and shutting down that practice. Also, at that time, we weren't even testing people. So, we've learned a lot, but so now we are just through our third pass of testing, offering testing to every employee of every nursing home. And we have these point-of-care tests. We're doing the mobile testing in nursing homes. So we're just a lot better at it than we were.
On nursing homes, I think yesterday your answer to Brian's question about, Massachusetts is allowing some people to visit their loved ones in nursing homes again. You doubled down on your decision not to do that. I think some folks are frustrated.
Yeah.
Can you just shine some light on the metrics that you guys are looking at to determine when you will allow that to happen again? I know you mentioned yesterday potentially during phase 3.
Yeah, I'm going to let the doctor answer this. I should say that our decision on that has been completely led. I have deferred completely to the Department of Health, so I'm going to let him answer that.
Obviously, it bothers us a lot that people can't go visit folks in the nursing home. I just want to get that out. It bothers me. We feel very bad about this. What we're looking for is this, and that this guidance should be released today, is every nursing home to actually develop a plan in assisted living for how they're going to accept visitors. I just want to emphasize the risk. And part of why we just need to get this out in the open is 80% of our deaths are folks older than 60 years old. Very vulnerable population for folks who live in nursing homes. Part of that, too, is just that, a lot of our folks who are older can do fine with home health care workers. We have a great home health care system in Rhode Island, so we should be very thankful for that. They do really good work. So when we get, though, to this, it's a very vulnerable population. So what nursing homes need to do is look at what they have as their nursing home and figure out for them how they can interpret our guidance, connected to the CMS guidance. CMS is Center for Medicaid Medicare Services, connected to that guidance as to what makes sense for that nursing home. Some nursing homes are going to be in different places than others are. Others will be like, we can figure out a way to do this in phase 3. We'll be okay to. Some are going to be like, we're not so sure we're ready. And part of what I'm getting into is, it's not like one nursing home is just like the other ones. They're different, and you have to look at the nooks and crannies of a nursing home to really see how does that nursing home interpret this. And it really gets to underscoring the concept, this virus is exquisitely transmissible. And I think it's just one of those things to really take home and just own as a concept is. The virus spreads so easily between person to person here. And if we could just hold on for a couple more weeks, my friends, I think we'll be in a much better place here. And I think that's just patience. It's hard. It's hard for me to be patient. But patience is action. And we're looking for the long haul here. This is a marathon. We are day 96 since patient number 1 in Rhode Island. Day 158 is a planet. There is much we have learned. In a few more weeks, I think we're going to be in a much safer place. And I would just ask us to hold on a little bit longer. And I know what I'm asking for people to do is hard. It's hard for me. I'm as frustrated as you are because it's really hard not to connect with our elders. It's so hard to connect with our spouses. I've heard so many stories from people saying, I really want to get back in there, and I get it. I really do.
Doctor, as long as you're at the podium, the National Counterintelligence and Security Center, which is part of the Office of the Director of National Intelligence, issued an advisory expressing some concerns that a number of the commercial laboratories that are handling testing are co-owned or otherwise responsible for things like maintaining a genetic database in China. And they've warned that this may concern people. Do you have any knowledge of any connections, or are these being used in Rhode Island? Are those the commercial labs that are doing work in Rhode Island? And what safeguards are there to prevent compromise of personal health information, including genetic material?
So the first I'm hearing about your question is right now, and first I'm hearing about that as an issue is right now. So what I will just say is I will look into it. The other thing I will just say is I expect every healthcare provider, every healthcare laboratory to follow federal and state law when it comes to protected health information. The other concept, though, is, and I think you brought up a really interesting concept about genetic material. That's important, and that's private, too. So we just can't willy-nilly throw things around here. But your genetic material is yours as well. That can't be released without your consent. So thanks for raising the issue. I'll look into it.
Dr. McDonald, while you're up there, could you just clarify exactly the distancings and the mask? I just came from a press conference at the State House, and we had state elected leaders shoulder to shoulder. And I said, you're supposed to be spaced out, standing there for over an hour, over in 15 minutes. And one of them, I don't know who, said, oh no, we're outside, we have masks on. But could you clarify for people, I was still under the impression, I think a lot of people, it's not like passing in a store. You should still be distanced when you're standing for a period of time.
Yeah, so exactly right. I don't care if you're outside or inside. You need to be 6 feet apart. Dr. Chan was just talking on a CME we were doing yesterday for the healthcare providers in the state about a recent study that showed if you're within 1 meter of somebody, much higher risk than if you're 2 meters out. So it's really important not to be near each other. And by the way, I get how unnatural that is, by the way. Like, we've grown up as a culture walking side by side each other. When we go to meetings, we think it's polite now to be next to each other. I know that's what we're used to, but what we're used to could be life-threatening to us. And so it's really important. We've done this before. Double arm's length away. I'm 5'4". I'm not quite, but that's, you know what I'm saying, my folks? What I'm saying is you got to be at least 6 feet away from each other. And, you know, one of the things I think is important, too, is, like, I love the way you're asking it. You're so gentle and respectful. But sometimes I think we just be really gentle and respectful to our peers who aren't doing these things. I'm in Home Depot shopping for, my little guy wants to put a garden in, right? So putting in the garden, right? And I'm trying to get a little watermelon plant. Someone comes right next to me. I just pulled back. If you need that watermelon plant more than I do, God bless you, go enjoy it, right? But I'm pulling back, same with my little guy, we're just staying 6 feet away. I'm role modeling in a polite way. I'm not judging others. I'm not yelling at people, nor am I encouraging anyone to. And I think it's just important to be really kind to each other. We're all learning these new skills. And when you see people, do this. I was invited to a public gathering. There was media there. People weren't 6 feet apart. Someone's talking. I just stopped the person and said, we're going to be 6 feet apart. This is what we're going to do. And everybody was like, oh, good, the doctor said that. And it made people feel better, right? And I guess what I'm saying to you is if you could just remind people, the reason why I want you 6 feet apart from each other is it's just safer for you. And I think it's just important. Like, I was hiking over the weekend down at Chafee Park in North Kingstown. I had a great time. I didn't see everybody being 6 feet apart. I'm not the 6 feet police, though, right? I didn't say anything to folks. What I did was I role modeled with my family. We were 6 feet apart from each other. And we're wearing our masks, too, by the way, because I just think it's important, all right? So thanks for asking. And by the way, whatever you do in this world, the reason I want you 6 feet apart is when you're closer than 6 feet away, when you exhale, you might be asymptomatically throwing out this virus, which I've told you it's a thief. I don't like the virus. I respect it, but I don't like it. You could be infecting someone else, and we have to be other-oriented. It's part of just recognizing the value of each other.